I'm Dr. Bradley Ashpole. I'm a board-certified plastic surgeon. I'm here today to talk to you about varicose veins. So everyone has little valves in their veins, and these valves are meant to keep the blood moving in one direction, up from your toes to your heart, so that the blood can recirculate. But in certain people, those valves don't work properly. What can happen is more blood pools in the legs than is supposed to, and this will cause the veins to swell, and that can lead to problems like pain, cramping, itching, fatigue, swelling, heaviness, and those are the symptoms that patients frequently come in and see me about. Often they didn't even know that the symptoms that they were having were due to veins, because most people think if they're not painful, they're not a problem. The other thing that many people don't realize is that because this is an actual problem and it is causing symptoms, in many cases your insurance will cover the cost of the treatment. What we do is, using an ultrasound, we can identify the veins that are underneath the surface that are causing problems. Then we can get into that vein with a small little needle. We can thread a little laser fiber inside that vein to exactly the veins that we know are causing the problems. We will give you a little numbing medicine around the vein, and when that laser is turned on, it will irritate the inside of the vein and cause it to close over the next several weeks. In that way, we don't get rid of the veins that are problematic, but we stop the flow in them so that the blood flows into veins that are actually working properly. Afterwards, most people will describe either no to minimal discomfort. Any discomfort that they have can usually be treated with just over-the-counter anti-inflammatories. We have you up and walking immediately after the procedure. There are no limitations on standing or walking after the procedure. For a brief period, we will just ask you to refrain from doing strenuous activities.